We have now gotten to the point where the blood tests that we've been working to develop for the last 5 years are really working quite well. There are multiple blood tests now that include p-tau 217 that have very accurate performance in identifying cognitively impaired individuals with amyloid pathology. And their performance really is very similar, and in some cases even better than FDA-approved CSF tests in identifying individuals with amyloid pathology or tau pathology. So people have been asking me for years whether blood tests are ready for prime time in clinical care. And I think the answer now is yes, that there are multiple blood tests that are very reasonable to use as part of clinical care. There are actually 6 blood tests as a clinician that I can order today on patients. And actually that's tests from 6 different companies. So this is exciting. None of them are FDA approved yet, but we are expecting that some of these tests will be FDA approved in 2025. And we think that some of them will be reimbursed by payers, insurance, and Medicare sometime in 2025. So this is really a big accomplishment for the field to now have these blood tests that I really do think are ready for prime time in clinical care. In terms of clinical practice, we are increasingly using these blood tests for selection of individuals to be in clinical trials, both cognitively unimpaired individuals and cognitively impaired individuals. And we're using these blood tests in a variety of ways in clinical trials, not just for selection of individuals with Alzheimer's disease pathology, but also to see how these biomarkers change with treatments. And there's a lot of work trying to develop new biomarkers that better correspond with clinical outcomes and with important issues like ARIA that we would like to use as part of our treatment process. And then in research, we're continuing to develop new biomarkers for Alzheimer's disease. So one that's particularly exciting is called MTBR tau 243, kind of a complicated name, but basically it's a fragment of tau that has very high correspondence with tau PET. So we have really not previously had a very good biomarker of tau tangles in the brain, and it looks like this MTBR tau 243 may be it. It's much more specific. So in other words, if you have tau pathology, it will be elevated, but if you only have amyloid pathology but no tau pathology, it will not be elevated. So there is data that's going to be coming out over the next 6 months demonstrating more about this analyte. And of course, other people are also working on this. And then many investigators are using the knowledge they have gained by developing fluid biomarkers for Alzheimer's disease and applying that to non-Alzheimer's disease causes of dementia. So things like cortical basal degeneration, progressive supranuclear palsy, frontal lobar temporal dementia, and Parkinson's disease, dementia with Lewy body disease. There's a variety of tests that are either currently available or in development for these disorders. And everything we're learning is helping to propel the field forward. So I'm very excited about the prospect that within a few more years, we'll have fluid biomarkers for multiple neurodegenerative conditions. So this is overall really just great news for the field.